Hello, and welcome to A Sound Constitution here on CHLY 101.7 FM, a show where we focus on health topics important to our community. This year's team is made up of 8 third-year VIU nursing students, and our goal is to demystify health issues and address common misconceptions by sharing evidence-informed information from a variety of reliable resources. All information provided on our show will be available in our show notes on Facebook and Instagram pages. We want to remind our listeners that the information presented in the show is for educational purposes only and does not replace the advice of your primary healthcare professional. If you have any questions or concerns about what's being discussed, feel free to reach out to us on Facebook at A Sound Constitution, Instagram at CHLY A Sound Constitution, Twitter at ASC_VIU, or email us at asoundconstitution@gmail.com.
We would like to start our show by acknowledging that we are on the unceded territory of the Nanaimo people, with a broadcasting range that overlaps the Coquitlam and Sliamon territories. This acknowledgement is done with the gratitude to the Nanaimo people and with the intention to increase awareness about truth and reconciliation processes and efforts on Vancouver Island. Additional information and resources surrounding the Nanaimo history, reconciliation, protocol, and land acknowledgement can be found on our Facebook, Instagram, and YouTube pages.
Hello everyone, and welcome to an episode on foot health. Have you ever wondered what are bunions, or what exactly are ingrown toenails? Well, then you've tuned into the right episode. This episode will be full of information regarding foot care and the overall importance of foot health. We have a very special guest with us that we interview, Tobro. And at the end of the episode, my group and I sit down and attempt a foot health misconceptions quiz and share some foot care resources located in Nanaimo. So stay tuned to learn more about foot health and what you can do to keep your feet healthy. So, why is foot health so important? To begin, the health of your feet can impact your overall health. By having poor foot health, this can lead to various foot conditions ranging from foot or nail infections to much more serious issues like circulation issues. Additionally, poor foot health can lead to a decrease in physical activity, which puts the individual at a higher risk of various medical conditions, including heart disease. So here are some basic foot care tips to keep in mind when caring for your feet, as described by the Government of Canada Putting Your Best Foot Forward resources. Number 1. It is important to examine your feet every day to watch out for any signs or symptoms that can indicate a foot issue. Examine your feet for dryness, breaks in the skin, and any unusual formations. If your feet are dry, a moisturizing cream can help, but remove any excess cream from between your toes to avoid skin breakdown. Number 3. Wear shoes and socks that fit your feet and are comfortable. Don't forget to change your socks daily though. Exercise daily. It's important to keep your feet active. When washing your feet, avoid soaking your feet for too long to avoid dry skin. When trimming your toenails, cut your nails straight across and avoid cutting them shorter than the end of your toe. And lastly, see a doctor when you notice any pain when walking that isn't relieved by rest. Reduce sensation to pain or extreme temperatures in your feet, any unusual coldness, numbness in your feet, and the change in color of your foot, especially if it persists to blue or purple, as it is essential to see a doctor since this could indicate poor circulation. Those with diabetes are at risk for circulation issues that can affect their feet. Therefore, these individuals should visit a podiatrist once a year for a checkup. Well, that's all for the tips on foot care, which was described from the Government of Canada resources on foot health. Stay tuned for more facts.
You know what that sound means? It's time for a fact break. Did you know that the ingrown toenail is a painful condition that is characterized by a nail digging into the outside skin? This can lead to inflammation and possible infection. This is a serious condition for people with impaired circulation, diabetes, or other systemic diseases. There are a bunch of different causes of ingrown toenails. 1. Being hereditary. 2. Improper nail trimming. 3. Trauma. 4th. Pressure from ill-fitting shoes. And 5. Biomechanical foot imbalances. So I bet you're wondering, what can you do about ingrown toenails? So for one, you can trim your toenails straight across as a preventative measure. You can also select a shoe style and size that is proper for your foot. And so you're also probably wondering, who should I go see for this? A podiatrist is the person you should go to. This person can perform a physical examination, and when needed, they can request an x-ray, a bone scan, CT, or different imaging studies. They can also remove the ingrown toenail. They can also culture it if it needs to be cultured for an infection. They can prescribe appropriate medications such as antibiotics, and if needed, there can be surgical correction done. Stay tuned for more information on feet on CHLY 101.7 FM.
In case you're just tuning in now, my name's Lauren and I'm here with my co-hosts McKenna, Kiana, and Karis, and you're listening to A Sound Constitution here on CHLY 101.7 FM.
Hi everyone. In this segment, I'm interviewing Jonathan Tomines, a registered chiropodist, which is a foot specialist. Jonathan is also known as the Toe Bro and has over 1.7 million subscribers on YouTube, where he shares videos on various foot health conditions. Jonathan's goal is to spread awareness on the importance of foot health and educate patients of all ages to provide the best quality of foot health care. So stay tuned.
Hi everyone, I'm here with Jonathan, a chiropodist, which is a foot specialist, but you all probably know him as Toe Bro. Hi Jonathan, welcome to the A Sound Constitution show. Thanks so much for sitting down with us today.
Thanks for having me. This is awesome.
My group and I have been looking really forward to your interview. We just want to learn a bit more about yourself. So can you tell us a little bit about yourself and your experience in healthcare?
Well, again, I'm a chiropodist or chiropodist. Not too many people actually know that term, so maybe I'll talk about that in general, because it's a crazy thing. In Ontario, before the year 91, there was no podiatry or chiropody model. And so the province was trying to decide what kind of model should we adapt. And so they decided to copy the UK, which was chiropody or chiropody at the time. So after the year 91, there's no new podiatrists that enter Ontario. So if you were to just graduate right now in BC or in the States, and you come to Ontario and you want to register as a foot specialist, you actually have to register as a chiropodist. It's really interesting. So the big difference between the two is podiatrists, depending on their training, can do bone surgery, and we can only do soft tissue surgery. So in Ontario, there's maybe 600 foot specialists and only 45 are podiatrists, and the rest are now chiropodists. And so it's a really interesting model because after we switched to chiropody, UK decided to switch to podiatry. And so we're the last place in the world to practice this chiropody. And even within Canada, it's different. There's only 3 provinces that practice podiatry, and that's British Columbia, Alberta, and Quebec. So if I was to go to those 3 provinces, I would not be able to practice because they don't recognize chiropody, my program. But if I was to go to other provinces, I would be grandfathered as a podiatrist, but not be able to do bone surgery. So the big thing, my parents were both nurses. My dad came from the Philippines to Canada as a nurse, and he practiced for 20 years. And when this program actually opened up in 81, he went back to school at the age of 40 to upgrade himself and become a chiropodist. And so he did that for 30 years. And I grew up, watching him start his business, learned a lot about how to deal with patients. And when it was time for me to decide what I wanted to do, I decided to follow in his footsteps and become a foot specialist like Papa Toe.
Papa Toe, which is amazing. I know the story. Jonathan is actually my uncle for all the listeners who don't know. So this is really special that he could come on the show today.
It is awesome. Yeah.
So what does a typical day of work look like for you? I guess you can kind of walk us through it.
Yeah, for sure. So I work in a private clinic setting. I'm lucky enough to own my own clinic. So basically I start the day maybe around 9:30. And how it normally works, we see a wide range of patients. Usually there's maybe initial consultations where we do a basic assessment. deal with their initial concern. Then we have a lot of routine foot care patients, whether it's diabetic foot care, wound care, foot pain. But usually we're seeing maybe around 20 to 25 patients a day. Before COVID, it used to be more than that, but we've now introduced longer appointment times, buffer times in between. But yeah, usually around 20 to 25 patients. And it's really exciting because we always get to see or meet new people dealing with different foot complaints. So one patient could be potentially a nail surgery. The next one could be a diabetic ulceration, or we have some routine clip and chip, as they say, cutting some toenails.
Mm-hmm. I know you mentioned a couple, but what are some common, I guess, like foot disorders you see at work?
For sure. So we'll start with like the whole parts of the foot. So one, nails. So we have ingrown toenails, thickened, damaged toenails. We have fungal toenails. So that's a lot that we deal there. And then we have skin issues. So we have, dealing with athlete's foot, eczema, psoriasis, rashes, warts, things like that can grow on the foot. Then we have foot pain, soft tissue issues. So we actually deal with bumps or lumps, cysts, non-cancerous tumors, just general foot pain, heel pain, arch pain. And then overall, sometimes people will come in with just feeling of instability, general foot fatigue or body fatigue, lower back pain, knee pain when they're standing and walking. So we do sometimes biomechanics. So again, we treat skin, nails, biomechanical issues. We have a pretty wide scope here in Ontario.
Which is awesome. Would you say you see one condition more than the other?
So the go-to to a foot clinic, and we call it in the industry, is clip and chip. So routine foot care is one of the main things that a foot specialist does. So that's, trimming toenails for people who can't reach, high-risk patients like diabetics, corn, callus removal. That would take up maybe 50% of the day. And then I would say maybe 20% of the day would be biomechanics, foot pain, foot issues in terms of maybe like ankle instability, general foot fatigue. And then the last part, which was 30% be mix of maybe some soft tissue procedures. So wart excisions, ingrown toenail removals in general. And then, foot cysts, bumps, warts, stuff like that.
How do you complete a foot assessment, I guess, when a client comes in?
Well, when you're a noob and you're students, you have to go through all your exams. The one thing I was going to say is I remember first year of chiropody school, and this is a 3-year program after a science degree. So, I always got to rep chiropody if you guys are ever interested. It's a 3-year program at the Michener Health Institute in Toronto, and it's an awesome program. It's 3 years, 2 years is classroom, and the third year is all clinic. And so I take students. But the first year you're learning about your assessments, you're like, oh, these are so boring. But what I've learned is the assessments are everything. It's so important to know all the different tests you can perform right there on the spot. That way you can right away know if something's kind of right, wrong, off, or something needs further investigation. So the main thing we're really looking at is, the skin and blood flow. Do they have good color skin? What's their skin tension like? Is it really taut, tight? Is it flaccid? Is it loose, dry, sweaty? Checking the temperature change. So then after just having a general look at the skin, we'll use the back of the hands to check the temperature from the front of the leg down to the toes. There should be roughly 2 degrees difference. So if we see increased warmth in the feet, that could be trouble. It could be more swelling. There could be more edema happening. If we have extremely hot to cold, we could have a blockage. We could have poor blood flow, arterial blood flow. So really just looking at the quality skin, temperature change. We'll look quickly at the nails. Are they normal in thickness? Are they curved? Are they fungal? Are they ingrown? Are they thick and damaged? All those kind of things, quickly looking at the nails. Then we'll look at the structure. We'll do a non-weight bearing exam. Do they have a high arch or low arch with no weight? When we stand, the foot changes position. Are they now collapsed? Are they still holding their position? Do they have bunions, claw toes, any sort of abnormal deformities in the actual structure? And then we'll take a look at the bottom of the foot. Do they have any signs of athlete's foot, fungal infection, maybe calluses or corns, which could cause problems for people who maybe don't have feeling in their feet or could be causing them discomfort. And just, again, looking at any sort of lesions that are present. So There's a great resource out there. I think they call it the 30-second diabetic foot assessment, but really it's something you can type in there, or so it's 1 minute foot exam. And I think all nurses, all healthcare professionals should really just go through it quickly, because it literally takes 30 seconds to a minute just to look again, the skin, temperature, nails, structure of the foot, and you'll have pretty much a quick overview of, is this person high risk or low risk patient. And then the last thing I didn't mention, of course, would be sensation. So neurological testing of that, all the nerve points in the bottom of the foot.
How do you differentiate between high risk and low risk conditions?
Yeah. So again, with all those different sections that we talked about, if someone has poor blood flow, you can't feel their pulses, they have extremely cold, extremely hot feet, that would be one check on the box, that potentially an issue. If they have no feeling on the bottom of the foot when you're doing the neurological testing, that's another check. Do they have corns or calluses? Do they have pressure points on the foot that could potentially become ulcerated? That's another check. So when people have multiple areas of concern, that's where they start to become more high risk. So the main ones that we are really concerned about are patients who have no feeling in their feet, and then couple that with hard skin, corns, calluses, maybe some poor biomechanics, which could potentially create these ulcerations or pressure sores. And if they have poor blood flow, then they won't have good healing ability. And then they're at high risk for infection, amputation, sepsis, all that.
Right. In nursing, they always teach us, like, don't forget the feet, always be checking that, because it's really important. What populations in the community would you say are at risk of poor foot health? I guess, or in Canada in general.
Mm-hmm. Now, the big thing, right? I think everyone says diabetics, like, oh, high risk. But the truth is, if a diabetic is properly controlling their blood sugar, overall health, diet, really, a diabetic really doesn't have an issue. The main populations that we see are poorly controlled diabetic patients. This is like the big one, because obviously if they have high levels of sugar in their blood for long periods of time, you'll start damaging the nerves. So they start losing feeling in the feet. Nerves also affect blood flow. So we'll see a more extreme dryness. We can get cracking. We can just get general poor blood flow. Then we have nerves also affect muscle function. So we start to see more foot pain, more foot collapse, poor gait, which again would then potentially overload certain parts of the foot, creating these pressure sores. So it's really loss of nerve sensation, which is most common in diabetics. If they're not controlling it, is the big population. The next one I would see is seniors in general, because seniors aren't able to reach their feet. They sometimes are very shy or embarrassed to ask for help. So they're really silently suffering from tons of foot issues. Something as simple as a super thick toenail that might be like this long, they're not saying anything. It's putting pressure on the shoe. And before you know it, we've seen ulcerations, infections go from bad to worse. And again, because of maybe embarrassment or the lack of the ability to get help, they're stuck with some serious foot issues. So I would say diabetics, seniors, and unfortunately, let's say the Aboriginal community, because again, they're kind of a combination of, they have a higher chance of getting diabetes, maybe not controlling it well, and sometimes the resources to find a foot specialist to maintain those foot issues, which puts them again at a really high risk. But anyone who has feet with those areas of concern really can have some serious foot issues.
What would you say are some self-care tips they can do for their foot health?
Yes. So one thing, I would say 80 to 90% of all foot problems really come from footwear, is having a good pair of shoes that are wide enough so it's not squishing the foot, nice and rounded. So again, the toes aren't being all bunched up. Have a little bit of a thicker, more shock absorbing sole to reduce that stress when you're standing and walking. And maybe something that has a little bit more stability, not super flimsy and flexible. If most people had a better shoe, they would be in so much of a better position with their foot health. Mm-hmm. So that's one, just proper footwear. Two, trimming your nails in a way that's safe for that person. Now, there's huge debate. Do you cut straight across? Do do you cut curved? It really depends on your nail shape. So some people can get away with cutting a straight across and they don't have any problems, but some people with very curved nails unfortunately cannot do that. So they have to maintain cutting short and down the side. But as long as you're trimming your nails safely, then that's no problem. If you're having issues cutting your own toenails, that's where really big problems can have. You nick, you cut, you create more nail or issues that could really lead to more infections or some severe ingrown toenails. So proper footwear, trimming the nails safely, and just looking at the feet on a regular basis. Are you seeing dryness? Are you seeing hard skin? Is there a crack? Is there a wound? Is there something abnormal? Is there a wart forming? So if people just spent more time looking at the bottom of the foot, they would probably catch these things before they would get really bad where they're in extreme pain. So this is a little bit tricky. The best way to do it is maybe putting a mirror on the bottom of on the floor, putting your foot on top of it, and then looking into the mirror, seeing the bottom of your foot. Now with phones, you could just, start recording a video, put your foot on top of it, moving it around, and then you can review that video just to see if there's anything that might be a little bit abnormal.
You talked about trimming nails. Is there like a specific tools you prefer when people are clipping their nails, I guess?
So it depends on that person's ability to reach their feet, their dexterity. The normal nail clipper that everyone has, the one with the lever has that rounded front, that's fine for most nails. But the problem when it has that curve, it's easy to sometimes go down too low on the side. So in practice and for a lot of patients, I use almost looks like a nail clipper or wire cutter. It's a little bit more precise. So if someone's flexible enough, has the dexterity, I would say to use something that looks more like a wire cutter because they can trim straight across better. They can have more control. But if someone doesn't have the ability to reach well, that could be very dangerous. So the standard nail cutter is fine. But if you have a tough time reaching your feet, it's better to trim the nail or leave it slightly longer. Now, one thing that a lot of people can do is maybe even use an emery board or file just to maintain the length. So not always having to cut the nail, you could just file it around the edges. And if you do that on a regular basis, you won't have to cut your actual toenails.
Mm-hmm. And you talked about proper footwear. That was actually one of the questions you're saying. How do you know what shoe is best fitted for you?
Yeah, so if you ever take your foot out of a shoe and the sides are really red, that's no good. You don't want to be having to break in your shoe. If the shoe feels tight and snug, it's not a good fit. We have to be like Cinderella. If the shoe doesn't fit, you can't wear it. Your foot should just slide in. The biggest test that I tell people to do is take the original cushion out from the shoe, put it on the floor and step on it. And if any parts of your foot, so some people might have a bunion or bump, if it's over the edge, no good. We want to see a healthy amount of fabric go over or around the whole foot. That proper width and roundness is so important. So I would say making sure we have the right width of shoes. If depending on the activity, if you're standing, walking a lot, having a shoe with, again, a thicker shock absorbing sole to help with some of that stress. And then I would say having maybe a finger in front of the longest toe. That way we're not, again, jamming the toes together that might cause them to curl. And then having something that has at least some more stability or support. So more straps or laces. Slip-ons can sometimes cause the foot to move around too much. Flip-flops, again, there's no support, the foot's moving around. So sometimes having more of a sandal with straps, running shoes with laces will just give you more support.
So that's saying break your shoes in is false.
It's not good to do, no. If it doesn't fit, it's just gonna be very uncomfortable. Now I have to be realistic because I get yelled at by women all the time. A few tips. If you are female and you wear size 8 and above, I tell all females they should be wearing a men's running shoe just because they're gonna have more width. They naturally make women's shoes narrower with more of a curl to make it look more feminine, but it really squishes the foot. So if you're over a size 8, I would try to wear more of a men's running shoe, men's boot, because you're going to have more comfort. Brands like New Balance come in multiple widths. So the standard width is B or C, which is technically medium or narrow. New Balance comes in D, 2E, all the way to 4E. So they have multiple widths to accommodate people with wider feet. So that's a huge thing. And then, of course, if women want to wear high heels, want to wear something that's a little bit stylish, I say you can do that, but just wear it for a small period of time. Don't be wearing this for a long period. If you're going to be doing a lot of walking, don't be wearing a shoe that's not going to be good for walking. Wear an appropriate kind of more casual walking shoe, running shoe, when it's that kind of activity. And when it is just a small thing going out looking good, wear whatever you want, but then get your feet right out of it.
Okay. Is there like a length for a heel that like should be avoided, or just shorter periods of time is okay?
Shorter periods of time. I'm not going to hate on the heels. They look nice. I know they don't feel good, but that's it's part of the game. No pain, no gain.
No pain, no gain.
Yep.
You've already kind of touched on this, but why is foot health so important?
Well, feet are the foundation of the body. They are what are carrying us throughout the day, through our activities. So if our feet are not functioning properly, it's going to cause a lot of problems for the rest of the body. So it's the first thing that touches the ground. We need the feet to be stable, functioning well, have no sort of hard skin, cracks, sores that could really cause some detriment. And again, feet aren't always on the cleanest surfaces. So again, having proper clean foot health, maintaining potential cuts, wounds, corns, calluses is super important. So yeah, we need our feet. We need to keep them healthy to keep us moving.
Hey everyone, we're just going to take a quick break from that interview and have Lauren give us a fact break.
This is Lauren with a fact break. Here are a couple of common foot problems as described by the British Columbia Podiatric Medical Association. First is bunions. A bunion is enlargement at the base of the toe caused by malalignment of the joint. It may be swollen, tender, and painful, especially when wearing shoes. 8 out of every 1,000 males have a bunion, while 38 out of every 1,000 females have a bunion. Some causes of bunions include hereditary, biomechanical abnormalities, neuromuscular disorders, inflammatory joint diseases like arthritis, trauma, and ill-fitting shoes. So what can you do? You can wear a shoe with good support and a wide toe box. You can apply cold compresses. Soak the foot in lukewarm water to relieve pain. You can use over-the-counter foot pads and over-the-counter anti-inflammatories such as ibuprofen. The next common foot issue is a flat foot. A flat foot is a structural deformity resulting in the lowering of the arch in the foot. This is sometimes referred to as fallen arches. A person with a flat foot or a highly arched foot that is fairly painful is in need of treatment. People with flat feet may have ankle, knee, or low back pain. Again, the causes of flat feet are hereditary, arthritis, trauma, and musculoskeletal disorders. So what can you do? Wear supportive shoes. Thanks for listening.
Thanks, Lauren. And now back to the interview.
Another question we have for you is, what is your opinion on nail salons and pedicures?
Yes, so a lot of people hate on nail salons. They sometimes in the industry call them chop shops, but they have their place for sure. If someone is a low-risk patient, has relatively normal nails, very little to no hard skin, pedicures are great because they can help maintain those basic foot issues. Now, the issue is when someone has more higher risk issues, more complex foot or skin or nail issues, if the technician isn't properly trained and they start to try to do some treatment or more aggressive cleaning, buffing, cutting, that's where problems start. So to me, pedicures, nail salons are great, but they have to have the right client profile. So someone who's not high, so someone's high risk, they should probably not be going to a nail salon. If they have very difficult to cut nails, you might have to see a foot specialist first to take care of those issues. And then they can go to the nail salon just to beautify, clean up, and just make the foot look pretty. So having the right client profile for the nail salon, and of course the nail technicians, making sure that they know their boundaries of what they can and can't treat, and then actually using tools appropriately to not cause risk to any patient. So avoid blades, cheese graters, anything that could cut the skin is really dangerous. So again, having the right tools for them to treat people. And the last part, sterilization. Feet, are not always clean. Nails, a lot of people have fungus, warts on the skin, and these things, if their instruments aren't being sterilized appropriately, they could be spreading them throughout the nail salon. So a lot of people are picking things up from nail salons because of maybe poor technique, poor sterilization, or just in general, not a very good hygienic environment. So I got to plug this in. So that's why I got tired of hearing all these issues or people complaining about nail salons. So I actually opened a medical nail salon next to my clinic called Nails by Tobro. So this is for a lot of our routine patients who are, again, very basic routine care. Even diabetics can go next door. All the equipment is sterilized to our level with, autoclave, ultrasonic cleaner, everything that will reduce the chance of any cross-contamination. All the tools are safe. The technicians know how to use them appropriately. If they have a more complex issue, I would come in to help just guide with that treatment, and then the nail technician can continue with treatment. Even with the nail polish, we pour out all the colors, the base coat, top coat, into separate individual bottles, so there is no sharing. Everyone's using the exact same nail polish bottle on the wall, and they've tested it, and there is fungus in there. It could potentially get into your nail. They don't know, yes or no, but again, everyone's sharing that same stuff. So I've really made it a point that we keep everything very much separated. Even our pedicure chairs have this bubble straw system, so there's no internal plumbing. So it's a liner with some bubbles, so you still with straw, so you get the bubbles, and when everything's done, everything comes out, everything gets flushed. So again, there's really reduced chance of any sort of cross-contamination.
And I was just kind of curious because you were talking about nail polish. Do you have an opinion on that? Like people painting their toes, is that harmful to the nail?
So this is the problem. If they have a nail issue, like let's say fungus, nail fungus, and they're trying to treat it, if they're painting their toenail, they won't be able to treat that issue. So they're just covering it up. It's not going to make it better. It could keep it the same, maybe worse, because we're creating, again, a sealed environment. So if someone truly wants to treat their nail fungus, they should not be using nail polish. But if it's a special event, I tell them paint the nail, look great, then take it off right after, and then continue with whatever treatment you're applying. If someone has a little cut wound, ingrown toenail, again, if there's any sort of open wound or irritation, nail polish can irritate that. So I just say, if the nails are healthy, skin's healthy, great, paints, I have no problem with that. The issue though is, what are they using? Gels, shellac involve more preparation, so there's a lot of buffing and thinning of the nail bed, and this could actually create nail trauma. It could create the chance, depending on the instruments, to contaminate the nail with nail fungus. So really, to me, a plain nail polish is the simplest, with as little damage to the nail bed, nail plate as possible.
Okay. Are there any misconceptions about foot health that you wish to address?
Yes, I don't have a foot fetish. That's what everyone says. You must love feet. The feet I see, yeah, they're not the best. So no, that's one thing all foot specialists get. Now, the biggest misconception I would say would be, you should only trim your nails straight across, because they're like to avoid it. Now, again, for most people, that is good advice, but there are some who have extremely curved, deep corners. And if they're not trimming down the side, they will not get relief. The nail will grow into the skin and cause problems. So really the way you trim your nail is dependent on your nail shape. So it's not just one way to treat or cut all toenails. So it's really specific for that each patient. Two would be maybe something with footwear, is that like, you got to break in your shoes a couple times. I would say if you're trying to break in your shoes, the shoe's probably too snug, too tight, and it's not a shoe you should be wearing very often, only for small periods of time. So I really believe that your foot should go in comfortable. Everything should feel spacious. Your toes should be able to move around to have that proper fitting shoe. And maybe the last one in general foot health would be like this whole barefoot running, minimalistic shoe kind of craze that what happened a couple of years ago. Now, having strong feet is one of the most important things for general foot health. If you have strong foot muscles and leg muscles, you're going to have less pain, less discomfort standing, walking for long periods of time. So in a sense, those minimalistic shoes, barefoot running shoes are great because they help strengthen your foot and improve that. But the truth is most people cannot go right into those shoes. It puts a lot of stress on those muscles. You have to really walk or train your foot properly to function in a certain manner. So I think, barefoot running, all that stuff, it can be great, but you have to really work your way up. It's not something you can start right away. I use barefoot running shoes for training so I can feel the ground, but it's not something I would do to run in for long periods of time because it would put so much stress on your foot without that extra padding, support, cushioning. So I find like it's a balance for depending on the person. And again, if they want to do that, really preparing, training their foot to be ready for that kind of stress.
Okay, we have a few more questions for you. What is your favorite thing about working as a chiropodist?
There's one thing, because it's seeing the patients leave feeling so much better. A lot of the things we do are like instant satisfaction. They have a very painful lesion, corn, callus, an ingrown toenail. We treat it and they walk out of the clinic feeling so much better. Because that's the most satisfying part. Because beside that, we are being covered in fungal dust, dead skin, debris, getting hit with nails. So that stuff is so gross, but it's the satisfaction knowing that they're going to feel so much better that keeps me coming back every single day.
Yes, I've watched a lot of your videos and you can just tell how personable you are with your clients, which is really nice. And just like how happy they are after they get like a procedure done or something. So that's really nice to see.
I'm a great actor.
Is there anything you wish people knew about their foot health?
I think, and this is the whole reason why I started my YouTube channel, is that there are foot specialists out there to help them with their foot issues. I feel that podiatry, chiropody still is sometimes very unknown. People really don't know what we do. And so I feel that we need just, again, continued expansion of what foot specialists do, educating the public about their foot health, and again, seeing the right people for those foot issues. So again, that's why I started the whole YouTube channel, was to just broaden the awareness for foot health in general.
And I'm hoping this interview too, and our episode on the radio, will kind of get people talking more about their feet, I guess, and their foot health.
Show me those toes. That's right.
I guess we're wrapping up here. Is there anything I've missed that you would like to share?
No, I want to ask you something. I'm going to put you on the spot.
Okay.
But what do you know about chiropodists, podiatrists, and foot health in general? What have you learned?
Well, I feel like my knowledge is like nursing, as a nursing student, head to toe. I know all like the foot assessment, but not as detailed as like what you assess when you're looking at people's feet. But I feel like I knew about podiatry from you, like learning about your job. I don't think it's talked about as much in the community, or even in like around people. Maybe some people don't like talking about their feet. But yeah, I think I learned most of it from you or from nursing school.
That's awesome. Again, not too many people know about it. So I think it's just a spreading awareness that there are professionals that focus strictly on the feet to help them with their foot issues. I think that's the biggest thing. And that I think we should always be looking at our feet and the feet of the people around us. It's really sad how many seniors are really suffering in silence. They get left behind, or really they never take off their socks. So even close family members never know what's going on. So I think everyone should just be more aware and take some time just looking at each other's feet in the family. It's not weird, I swear.
No, it's not, for sure. I think that's it for our questions. Thank you so much, Jonathan, for coming on our show. We really appreciate it.
Oh, thanks so much for having me. Anytime you want to talk about feet, I'm here.
Thank you.
If you are just tuning in, you are listening to A Sound Constitution. In the previous segment, we interviewed Jonathan Tomines, a registered chiropodist who's passionate about raising awareness on the importance of foot health. Stay tuned for some more information on foot care.
This is Karis with a fact break. This information is from the British Columbia Podiatric Medical Association. Have you heard of a hammer toe before? A hammer toe is a contraction deformity that occurs when your muscles, tendons, joints, or other tissues tighten or shorten, causing a deformity, resulting in bony bumps on the toes. Causes of hammer toe could include hereditary, ill-fitting shoes, muscle or biomechanical imbalances, or arthritis. What can you do to treat it? Well, you can wear a supportive shoe with a deep toe box, apply cold compresses to the bony prominences, and soak the foot in lukewarm water to relieve pain. What can a podiatrist do for you? Well, they could perform a physical examination, request an X-ray, bone scan, CT, MRI, or other imaging tests, perform toenail trimming and fittings for different padding devices, recommend over-the-counter arch support, or prescribe a custom orthotic, and lastly, if necessary, perform a surgery. Thanks for listening. Now back to the episode.
As Jonathan mentioned in the interview how to find the perfect shoe, here are some additional tips and tricks when looking for shoes in the store. Some of you may be wondering, how do I find the perfect shoe? Well, here are some tips and tricks that the British Columbia Podiatric Medical Association recommends when looking for shoes. Number 1. Examine the shoe. Look for shoes with a firm heel counter. This means having stiff material on either side of the heel. The shoe should also have adequate cushioning of the insole and a built-in arch. It should be flexible enough to bend where the foot bends at the ball of the foot. Number 2. There should be about 1 to 2 centimeters of space between the tip of your toes and the end of the shoe. You should be able to comfortably wiggle your toes in the shoe. Number 3. Try walking around the store when trying on shoes. This is so that you can determine if there are any pressure spots in the shoe that cause irritation. Number 4. Shoes should not slip off at the heels, so that's why it's best to walk around when you're trying them on. Number 5. Measure both of your feet. Some people might have one foot a little bit bigger than the other one. If that's the case, it's best to go with the bigger size. Number 6. Cushioned sole shoes that give good support are recommended for those who spend lots of time on their feet, for example at work. Number 7. When looking for athletic footwear, find a shoe that holds your foot in the position that's most natural to the type of movement involved. For example, running shoes are built to accommodate impact versus tennis shoes. They are made to provide support. Number 8. Lastly, a little side note. It doesn't hurt to give your shoes a break, so try rotating your shoes throughout the week. This prolongs the life of your shoes. Well, that's the end of the tips and tricks. Hope it helps with finding your perfect shoe. If you're just tuning in, you're listening to A Sound Constitution on CHLY 101.7 FM. And today, we're talking about foot health and how you can keep your feet healthy and happy. And now, we're going to have a Sound Constitution foot quiz using the resources found on MedicineNet, starring your hosts, Karis, Kiana, Lauren, and McKenna. Let's see how the hosts do today.
All right, our first question is, all blank have flat feet? A, elderly people, B, teenagers, C, babies, or D, men?
I'm not really sure what the answer is. I know my mom talked about having flat feet after pregnancy, but that's not an answer. So I'm just going to go with babies because I feel like maybe they're underdeveloped or something along those lines. I'm not sure.
The answer is, in fact, C. All babies have flat feet. This is because their arches are not yet formed. Flat feet may persist into adulthood, though an arch may also form as the child grows.
Question 2. True or false? People with flat feet are sometimes clumsy from prolonged walking or running.
I feel like that could be true, maybe like a balance thing.
If they don't have an arch, I think they probably could be a little bit clumsy.
And the answer is true. Flat-footed people are sometimes clumsy and fatigued from prolonged walking or running, as this condition can cause an uneven distribution of body weight. Flat feet are not as proficient at keeping the body stable as feet that have a normal arch. People with flat feet are at a higher risk of developing chronic muscle strain due to the foot's lack of stability. Shoes with built-in arch support can help with these problems.
Question number 3. Feet are their largest, A, in the morning, B, when you're sleeping, C, when they are wet, or D, at the end of the day?
I would say probably at the end of the day. Like, I remember hearing about that's the best time to buy shoes because they kind of swell up.
That sounds right to me.
The answer is D, at the end of the day. Feet are at their largest at the end of the day as they swell throughout the day. Because of this, it's the best time to buy shoes to ensure a proper fit.
Okay, number 4. Shoes with heels are recommended to be no more than A, 1 inch high, B, 1.5 inches high, C, 2 inches high, or D, 3 inches high.
I'm not really too sure about heels. I feel like they're probably more uncomfortable the higher they get, and I'm wondering if that means that they're worse for your feet the higher that they get. So I'm gonna go with 1.5 inches just because it's kind of in the middle.
That makes sense to me. I feel like 1.5 inches as well. Any higher than that, I feel like your foot's has more pressure on the ball of the foot or something like that.
The answer is 2 inches high. Switching to lower heels will help you avoid problems with the metatarsal bones. The lower you go, the more natural your foot position will be. The American Podiatric Medical Association recommends choosing heels that are no more than 2 inches high.
All right. This foot condition mainly affects women. A, bunions, B, plantar warts, C, ingrown toenails, or D, all of the above.
I'm pretty sure it's going to be bunions. I don't think plantar warts or ingrown toenails discriminates, but I could be wrong.
But bunions do.
Well, I don't know. I feel like I know I have people, women in my life who've had bunions. I don't know if I know any men.
I only know my brother because of climbing shoes, but that seems like a niche thing. The answer is, in fact, A, bunions. Common in ballet dancers, a bunion is a painful lump at the base of the big toe, which may cause the toe to bend unnaturally. It forms when the tissue or bone at the base joint gets displaced. This may happen after years of abnormal pressure and movement. Pointy-toed shoes are a common factor, which explains the prevalence in bunions among women. Pain relievers, pads to cushion the bunion, custom shoe inserts, or surgery may help. To avoid bunions, it's best to wear roomy shoes and avoid high heels.
All right, our next question is, how many bones are in the human foot? A, 5, B, 12, C, 17, or D, 26?
I remember from human anatomy that there was quite a few of them in there, so I think we got to go with a higher number. My guess would be 26.
I mean, I definitely don't think it's 12. I'm just thinking about there's 5 toes, so there's definitely more than 5 bones in the human foot. But anyways, the answer actually is 26. The human foot has 26 bones total.
Question number 7. This condition causes the deformity of the second, third, and fourth toes. A, a fracture, B, frostbite, C, tarsal tunnel syndrome, or D, hammer toe.
Well, it's definitely not frostbite since that can affect any of the toes. I don't think it's fracture or tarsal tunnel syndrome, so I might go with hammer toe. No idea what that is, though.
I agree, just through process of elimination, but I don't know what hammer toe is.
The answer is D, hammer toe. The term hammer toe refers to a common deformity of the foot in which either the second, third, or fourth toe is bent at the middle joint so that the tip of the toe is bent downward while the middle of the toe is cocked upward, resembling a hammer. The hammer toe deformity is the most common deformity of the small toes. The condition can be present at birth or can develop as a result of wearing poorly fitting shoes.
Okay, next question. True or false, athlete's foot is caused by bacteria found in places such as gyms, locker rooms, and nail salons?
I'm gonna say true because I feel like that's why you would wear flip-flops in the shower in those places.
Yeah, and that makes sense to me because, I know if an athlete's going to go into like a gym or a locker room, so athlete's foot seems about right.
The answer is actually false. Athlete's foot is caused by a fungus, not bacteria. The medical name for athlete's foot caused by a fungus is tinea pedis and can be contracted in many locations, including gyms, locker rooms, swimming pools, nail salons, airport security lines, from contaminated socks and clothing, and from direct person-to-person by contact.
9. Painful inflammation of the big toe usually indicates this type of arthritis. A. Gout, B. Rheumatoid arthritis, C. Osteoarthritis, or D. All of the above.
Osteoarthritis is bone, so I don't think it's just big toe. Rheumatoid, I think, is full body as well, so I'm going to go with gout.
That is correct. Gout is when high levels of uric acid build up in the body, forming crystals that harden in various joints of the body. The small joint at the base of the big toe is the most common site of an acute gout attack of arthritis. An acute attack of gouty arthritis at the base of the big toe is medically referred to as podagra. Other joints that are commonly affected by gout include the ankles, knees, wrists, fingers, and elbows.
All right, we have our last question here. True or false? Metatarsalgia is a condition describing acute pain in the ball of the foot.
I'm not quite sure what that term means, so I'm not 100% sure what that condition could be.
Yeah, me neither. I've actually never heard of that one.
All right, so the answer is true. Metatarsalgia is the medical term for acute pain in the ball of the foot, a common overuse injury. Metatarsalgia can become chronic as a result of stress and pressure on the ball of the foot. This is often caused by shoes and actions that put abnormal amounts of pressure on the ball of the foot, such as high heels and high-impact sports.
And now we're just going to share a few foot care resources in Nanaimo. All of the information and addresses will be listed in our show notes.
Our first resource is Island Foot Clinics at 1808 Bowen Road, number 201. The podiatric physicians and surgeons here specialize in all foot and ankle conditions ranging from simple ingrown toenails to complex surgical matters such as reconstructive surgery.
The second resource is Coast Podiatry Clinic, 4750 Rutherford Road, number 143, located in the Caledonian Clinic. The services offered here range from new emergency ingrown nail surgeries, gait examinations, custom carbon fiber orthotics, and sports medicine injuries.
Lastly, we have Ocean Walk Podorthic Clinic, 5180 Dublin Way, number 102. This clinic focuses on the assessment, care, and treatment of diabetic, arthritic, and painful foot conditions due to biomechanical dysfunction.
And that concludes the Sound Constitution Foot Quiz, which used MedicineNet resources. Congratulations to our host. You scored a 7 out of 10. As we are approaching the colder months, the concern of frostbite rises. So what is frostbite? Frostbite can affect all layers of skin, and it occurs most often on feet, toes, hands, ears, and fingers. Frostbite is defined as damage to the skin by the extreme cold. The Emergency Care BC Provincial Health Services Authority classifies frostbite in 4 categories. The first category is first degree. First degree is superficial, which causes numbness and a white or yellow firm and slightly raised thickening of the skin, which develops in the area of injury. Second degree, also superficial, causes blisters and slight swelling. Third degree frostbite causes deeper blisters similar to fourth degree, although fourth degree can cause necrosis, which is the death of body tissue and is a serious issue. The recommended treatment is rapid rewarm in water heated and maintained between 37 and 39 degrees Celsius, followed by pain control with medications. The affected extremity should be air dried and elevated. Depending on the injury, there is a specific dressing criteria that is followed. All of the information can be found in the show notes.
Hi everyone, this is Lauren with a Sound Constitution, and I'm here to inform you of a fundraiser we are organizing this month. There are currently around 400 people without residence in Nanaimo. With temperatures slowly dropping, frostbite is a genuine concern, especially for this vulnerable population. Our team at A Sound Constitution would like to aid in decreasing the incidences of frostbite to promote foot health by organizing a shoe and sock drive at VIU from the dates of November 8th to November 30th.
This fundraiser will be open to all to donate any clean socks or gently used shoes for the unhoused population in Nanaimo. The drop-off location for the donations will be at VIU, located at 900 5th Street, Nanaimo, in Building 210 on the 3rd floor, where there will be a donation box labeled with a sign. These donations will be collected and distributed by the Tillicum Lalum's Outreach Program, located at 927 Halliburton Street in Nanaimo.
We'd like to encourage our listeners to participate in this fundraiser and donate any clean socks or gently used shoes for a good cause. If you have any questions or concerns regarding the fundraiser, you can email us at asoundconstitution@gmail.com or contact us on Facebook at A Sound Constitution or Instagram at CHLY, A Sound Constitution. This has no spaces.
And in case anyone missed the drop-off location, it'll be at VIU located at 900 5th Street, Nanaimo, in Building 210 on the 3rd floor. We'll be advertising this fundraiser on our social media platforms, so keep an eye out to stay in the know.
As this is our group's final episode of the season, we would like to thank our instructor Sandy and our field guide Arby for all of their support, as well as all of our listeners for tuning into our episodes. This is Kiana,
Lauren,
McKenna,
And Karis.
signing off.
Well, that sound means you've reached the end of another episode of A Sound Constitution. Thank you everyone for tuning in today with your hosts, Lauren, McKenna, Karis, and Kiana. Be sure to connect with us on Facebook, Instagram, and YouTube. Join the conversation, access our show notes, and be in the know for our next episodes. As always, our friendly reminder to our listeners that the information presented in this show is for educational purposes only and does not replace the advice of your primary healthcare professional. If you have any questions or concerns about what's being discussed, feel free to reach out to us on Facebook at A Sound Constitution, Instagram at CHLY A Sound Constitution, all one word, or email us at asoundconstitution@gmail.com. Don't forget to join us next week for another episode. Until then,